Welcome to this press conference. Today, the Premier of Quebec, François Legault, is accompanied by Health Minister Christian Dube, as well as Public Health Director, Mr. Horacio Arruda. Mr. Legault, the floor is yours.
Oui.
Yes. Hello, everybody. Well, first of all, I want to send my sincerest condolences to the family of the Wendake community. This event touched all Quebecers. It's always impossible to understand when somebody kills two young children. We wonder why. Why did they get to that point? Obviously, all of the necessary investigations will be undertaken. There's an investigation by the Centre-du-Québec, and obviously, given there are some deaths, there's an investigation by the coroner. We're learning this morning as well that there is an investigation of the Human Rights Commission and Youth Rights. And Minister Denise Garmand as well has triggered an inquiry to see exactly what happened with youth protection in the National Capital. What is the information that was received by youth protection? For the time being, we don't have this information. We are gathering this information, and as soon as we have more details, we will be fully transparent. But clearly, today, all of our thoughts are with the family. I'm going to come back to the update for COVID. 815 new cases today. Obviously, we are very, very prudent before we celebrate too much, but we have seen over the past few days that things seem to be stabilizing. We went between 800 and 1,300, so around 1,000. We don't seem to be going towards 1,500 or 2,000 cases, so once again, it's early. It's too early to celebrate, but there is reason to believe that the efforts that we are making are bearing fruit. So thank you to all Quebecers, despite the long weekend, who were careful with their gatherings, particularly in Montreal and Quebec, where there are the most outbreaks. However, we have seen on our end that the virus is spreading in regions other than Montreal and Quebec. And that is why today, public health is adding some red zones. So all of the Montérégie, all of the Centre-du-Québec, the national capital, including Charlevoix, all of these regions are moving to red. The measures that come with the red zone will be put into effect gradually. I think that we're talking about Friday. And there was an increase, a certain increase in the number of cases as well in the Saguenay-Lac-Saint-Jean, which is now going to the orange zone. What that means is that we have to continue throughout Quebec to make some efforts. There's no magical recipe. We have to reduce contacts, and public health in Quebec, like just about everywhere else in the world, well, is putting in place some measures to reduce social contacts. We are not the only ones who are living with the closures of restaurants and theaters and closures or fewer activities, sports activities in a group where there is contact, fewer visits in homes. The solution is simple and it's complicated at the same time. There have to be fewer contacts. What I understand, I'm not an expert, but in discussions with the experts in public health, what I've come to understand is that where it seems to be most significant is gatherings within homes. We can see that more and more specialists are saying that there are a few people that infect many other people. So a minority of people is infecting a majority of people. And that is during big gatherings when there are several people gathered together. Obviously, we're not going to start talking about the reproductive ratio, but when one person infects one person, but when they infect 10, 20 people, that's where we have a problem. And what that means, clearly, is that we must be prudent, especially in spaces that are smaller. Even if you're 2 meters away, it's possible to infect people, especially if we are in a room for more than 15 minutes. So obviously the room here is a little bit bigger, but let's think about homes, smaller spaces. Obviously, when there are gatherings for more than 15 minutes indoors, we increase significantly the risk of transmission. That gives us an idea of where we're going as well over the next few months. We are not close to opening up big gatherings indoors. So we have to continue to make some sacrifices. And I'm repeating myself, 3 good reasons to make these sacrifices. First of all, to save lives, save the lives of the most vulnerable, the elderly. The second good reason, to allow our young people to stay in school. And the third good reason, so as to help all of the healthcare network staff. It's been 7 months and even more that they've been under pressure. And already we know that for the past few years there's been a lack of staff in the healthcare network, so we have to help them so that we can continue to care for people. And I'm telling you now, it may be you. If you get sick in a month or 2, we have to be able to continue to provide care. It's as simple as saying, well, if there are some people in our hospitals who are taking care of COVID patients, well, they're not available to provide care to you. So it's very important to limit the pressure on our healthcare system. In closing, my thanks of the day. Well, it's for the lab staff. I don't know if you know, but when you look at the increase in the number of tests, yes, we can have some staff to do some contact tracing, but the people in the labs we're limited to a certain number of people, and they've been working very hard for several months. So I want to say to all the staff, all the people who work in laboratories, thank you very much for your work. Thank you for the long hours and for everything that you have done over the past few months. I will close by saying, clearly, there will be, we will have a certain number of restrictions for several months. I was saying earlier, even the big gatherings, the big indoor gatherings, especially when we are more than 15 minutes in the same room. We will have to be patient. We will have to develop new habits. I am asking you as well to download the COVID Alert app on your phone. It's important. And if you get a positive result, well, put it in so that quickly we can identify the people that you were in contact with in the previous weeks and test them, and if needed, isolate them so that we can avoid the virus transmission. So we all have a role to play, and I thank you for the efforts that you've made this weekend. It seems to be leading to results, and we have to continue over the next days and weeks.
Good afternoon, everyone. We're seeing that the contagion seems to have stopped increasing, but we must remain very cautious. This would mean that our efforts are paying off. But the virus is spreading in more regions. That's why we're announcing that the regions of Montérégie, Centre-du-Québec and Capitale-Nationale, including Charlevoix, are turning red, and the region of Saguenay-Lac-Saint-Jean is turning orange. The most important thing to do is to reduce indoor gatherings. We must continue to make sacrifices for three main reasons: save lives, keep our children in school, and save our health system. We'll have to live with the virus for many months, and there's no magic recipe. We must avoid indoor gatherings of more than 15 minutes. And I ask you to install the COVID Alert app. Everyone has a role to play. Thank you.
We will start the question period. Question. Hello. Mr. Legault, you ended your press conference with your thanks for the people who are working in the labs, and they are working very hard. What's happening with the quick tests? I don't know if Mr. Dube or Mr. Legault can answer this question. Where are we? How many are there, etc.? We're quite advanced. You'll remember that perhaps 2 weeks ago we mentioned some progress that we had made at the Cité de la Santé in Laval. Currently, that's under the governance of Dr. Patini. We have 3 types of machines right now that will be deployed over the next few weeks. So there will be some that will be bought in October, November, and December. So first, we will increase the capacity. But this type of equipment usually doesn't have a high volume. For example, there's one called ID Now. You've surely heard about it. It's got great qualities, but it's got certain problems as well. If we want to do high volume, it doesn't work. But if we wanted to, for example, work more on, for example, let's say our school corridors and to have a limited number, but in specific regions, well, then it works quite well. So now that we have secured some equipment with our suppliers, and I gave you that example, there are 2 others, we will deploy it in the next few weeks. So we're advancing, but it's complementary to the high volume testing that we're doing now so that we can put them in the right place. And I would say in the regions as well, because as you know, in the Gaspé or on the North Shore, we don't have the same volumes of tests, and we could move high volume tests that we're doing over there. We could use new equipment for smaller volumes, but that's what we're working on right now. Follow-up question for Mr. Legault concerning another topic, but I think it's important to hear you for the good of the economy in Quebec. The governments, should they intervene to stop the sale of Transat? And that's what's happening now. And I heard the analyst Michel Nadeau, who said that it would be more judicious to wait for the storm to pass before going forward with the sale. Will you intervene or talk with Ottawa? These are 2 private businesses. And second of all, well, we can think that for a certain number of years, there will be less volume in air transportation, so too many planes, and that becomes a problem for all of the airlines. How can they temporarily get rid of some planes and some leases on these planes? Now we could speculate, is there a potential buyer? There's no question the government will not go down this road alone to operate an airline company, that's for sure. Now, there was a transaction that was there with a certain value from the airline companies, but with the decrease of volume that's forecasted for a while, there's a decrease in value, not just for Transat, but also for Air Canada. So when we talk about trading shares, we have to take into account the new values or the new valuations of airlines throughout the world. It's very hypothetical. I'm not aware of a private buyer who would be interested in buying Transat for the time being. Question? We see that there's a decrease in the cases since the main zones have gone to red. You said that it's stabilized. And we can see that there are some people who are not respecting the health measures. We saw in Boisbriand that there was a gathering in the Hasidic Jewish community. Will you maintain the level of alert and the restrictions? Or will you open up the tap until there's another increase and then reconfine later? I'll begin with the first part of your question, and Dr. Arruda can add to my answer. I would like to take this opportunity to salute the work that was done by the police officers this weekend in the case of the event that occurred in Boisbriand, because it was very delicate. There were over 750 people who wanted to participate in a religious event which did not respect at all the health measures. There were even some people from outside of Quebec. And I think that our police officers, I know that our police officers did incredible work. They were able to disperse the crowd. It was done correctly, and we avoided the worst, because perhaps there will be some results, some infections, but it could have been even worse. And I would also like to thank the people who informed us of the situation, because these, before, these are events that perhaps we would not have been informed of. So I want to tell you that for us, it's easy to say that it's not acceptable, but I think the police officers did very delicate work and they succeeded. So for me, that was important. Now are we going to go to red? Before letting Dr. Arruda speak, we can see the strength of the alert system that we've put in place. Because up until now, we were able to follow the game plan and to have an approach that is very regional, very targeted. And perhaps people are saying, well, how come, when you look at the map and we look at the whole St. Lawrence Valley, and when you look at the other third of Quebec, which is in orange and then the rest in yellow, well, I think that demonstrates that it has worked. To work step by step, but also to keep a balance between keeping our schools open, keeping businesses open in certain regions, but at the same time acting in a way, and I'm being very prudent here, well, we've succeeded over the past couple of weeks to at least stabilizing the situation. So I think it's working. It would be too easy to say we're putting everybody in red, and we would hurt places that don't need to be restricted. Why close a restaurant in Lac-Saint-Jean? Or why have restrictions in the lower St. Lawrence when we don't need to? So we will continue to be very targeted, as we are now, with the participation of people. What I have seen this weekend on the Mont-Royal, people were respectful. They need to get some fresh air. We told them, go outside. And I think that things were done correctly. There were a lot of people, but still, those who were there as a whole respected the rules. So I think that we'll continue to have very targeted actions if we want people to continue to respect the rules. And we've been seeing this for several weeks, and it seems to be working. I'm very satisfied. Dr. Arruda, I don't know if you want to add anything. Dr. Arruda? Essentially, it's too soon to talk about what's going to happen the 28th of October, right? We are, 15 days in a COVID-19 situation is an eternity. But what's clear, and I don't want to celebrate too early, but we feel that we've reached a certain plateau. People have probably been respecting the restrictions. I don't think that we can come back to the freedom that we had this summer necessarily, or the last periods with big gatherings, as long as we haven't stabilized the situation. Second question, Mr. Legault, we heard you on Transat, but I wanted to know, the government or the Caisse, could they intervene to encourage Quebec investors to make an offer? I would like to remind you, and sometimes we forget that, the head office for Air Canada is in Montreal. Most of the head office activities for Air Canada are in Montreal. So we have to understand this. This is a company that is from Quebec that is buying another Quebec company. There are some activities like maintenance, operations, that we'd like to see more of in Montreal, but it remains that the head office for Air Canada is in Montreal. Now, in order to support whether it's Investissement Québec or the Caisse de dépôt or another Quebec buyer, well, there would have to be one. a serious buyer. Question. Hello, Mr. Legault. Why has your government not followed the recommendations of the Institut National de Santé Publique, which asked you to reduce by half the number of students in the classrooms in high schools, in grades 10 and 11? Well, there's a difference between the ENSPQ and public health. The ENSPQ is an organization, an independent organization. We follow the recommendations of public health. What we have to understand is that there are some recommendations that are easy to follow, but just about impossible to apply. If tomorrow we say we'll reduce the size of the classrooms by half, well, it takes us twice as many classrooms, twice as many teachers. I would like them to tell us where we can find this. We have chosen to go 1 day out of 2 for grades 10 and 11, but we have followed the recommendations from public health. Mr. Trudeau declared this morning that to march down the road to reconciliation with the Aboriginals, we have to recognize systemic racism. It's a question that divides your caucus. Could your opinion evolve? And what do you think of Mr. Trudeau's remarks? Well, listen, Mr. Trudeau should know that in Quebec, there are 2 groups. There's a group of Quebecers who say, yes, there is a system of racism, and there's a group of Quebecers who says, no, there is no system of racism in Quebec. However, all Quebecers agree to say that there is racism in Quebec. So there's a group that's saying there's no systemic racism. The other group says there is systemic racism, but everybody agrees to say that there is racism, and we have to fight against racism. And I think that my role as a Premier of Quebec is to gather Quebecers, to unite them, and to act finally, because we should have acted a very long time ago, so as to fight racism, including with the police officers, including in hospitals like the Joliette Hospital. So for me, that's the best approach. Now, what I understand is that Mr. Trudeau has another approach, and that is his choice. But could your opinion on this change? Do you think that you may? Are you closing the door to? Well, I think that currently it would not be a good idea to turn our backs on a good portion of Quebecers who believe that there is no system of racism in Quebec, like Mr. Trudeau is proposing. I think it would be a mistake. Question? Mr. Premier, you repeated several times that indoor gatherings, is at the heart of the matter when it comes to fighting COVID. I just looked at my calendar. We are 10 weeks away from Christmas. Should we schedule several small suppers instead of one big supper? I understand that we're far away from Christmas, but you're talking about several months with measures. Is this what you are seeing for the holiday season? Listen, it's too soon to talk about Christmas, but what we're seeing more and more throughout the world is that we have to avoid big gatherings indoors in smaller spaces. How long will that last? When will the vaccine come? It's too soon to say. Last week, the regional director, Dr. Drouin, said that in the future, perhaps it would be better to keep a high standard of public health measures so that we don't yo-yo. We go to almost full freedom and then we're almost confined again. Is this the trend for the next weeks or the next months, to maintain something quite strict so that we don't flip-flop? The ideal is to not yo-yo, but when you look at just about all the countries in the world have yo-yoed, we've got before us a situation that is exceptional. Nobody has experienced this before. So we must adjust. And we are trying to open the tap a little bit to have a more normal life. And then at some point, when we see that we've opened it too much, we close it down a little bit. And that's what's occurring throughout the world. Question? Hello, Mr. Legault. If ever the Committee of Action Against Racism says that recognizing systemic racism is a step in the right direction, will you take into account this recommendation? Well, listen, I don't expect that the group, because I've been in discussions with them, I don't think that they'll come to that conclusion. Mr. Trudeau talked about the care for the elderly throughout the country by saying that it was illogical that there were some elderly who were treated differently from one region to the next throughout the country. What do you have to say to this? He's talking about national standards. Well, listen, I think that Mr. Trudeau is playing with fire because all provinces have asked to have a transfer, an unconditional transfer to increase the health transfers to the provinces. I don't think that the federal government should get involved in the management of long-term care homes. I think that Mr. Trudeau is making a mistake when he proposes centralized measures. I think there's a consensus amongst the provinces like Quebec and Ontario to have more autonomy on the choice of the means to reach our objectives, in particular in a field of competence like health, which is a provincial jurisdiction. Question for Dr. Arruda. There are several specialists from the University of Montreal and McGill who are asking you to publish more numbers, specifically when it comes to the rates of infections per region. They're asking that you be more transparent. Apparently, it's being done in other provinces. Well, these rates are the ENSPQ site. There are some reports. I don't know if people from McGill did not look at them. There are some rates, the number of cases per region. That's on their website. I think that people can go read that. People can get the cases by region, by sub-region, all the rates in their territories. A question for Mr. Legault. Your government often has brought up the famous plateau. Now, over the past few days, we seem to have reached it. In your opinion, is this livable for a long time, this plateau, or will we have to decrease the number of cases before we can live with fewer measures and restrictions? I will let Dr. Arruda answer. I think we have to look at what will constitute a plateau. Where will be the cases? What are the outbreaks? What are the environments? If we can investigate each one of the outbreaks, if we can do a search and contain in an adequate manner, it's possible that we will stay with that plateau and that we will open up certain places that are currently closed because they do not generate cases. I think that there's a lot of ifs. It will depend not on a number or a plateau, but how. What is the composition of the number and the plateau, and mainly the impact, if you'll allow me, on our elderly, on our care settings. Because having cases without hospitalizations, without a significant increase, it's very different. It's community transmission, it's people who are younger, but when it has an effect on care settings, well, we have to take that into account to see what we're going to open. Perhaps I would add one point. Look at the stats that we've got today, 815 cases, but we still have 46 new hospitalizations. We were suggested, I accepted. There are a few doctors who have asked me to change the way that we reported, and instead of showing only the net hospitalizations, now we're showing the gross, how many people came in and how many people exited the hospital setting. So I think that's a nice improvement that we're implementing today. But what that means is that the 46 hospitalizations that we have today, these are cases that were identified maybe 10 days ago. So the first objective is to decrease the number of cases because we don't want to have hospitalizations in 5, 10, or 15 days. And that is why your question is very apropos, but we repeat every day. Today makes a difference in 15 days from now. That's how we have to look at things. Question? A question on the staff. You had promised 10,000 orderlies for the fall. Is that still realistic? And you said that there would be a decree to limit the mobility of staff and the movements of staff. The challenge, a 10,000 challenge is there, but we will attain it. We are a little bit below 7,000 because there were some adjustments, but I think that really helped the network, and everybody recognizes this. Is it perfect? No, there are still some adjustments to be made, but for me, the first 7,000 is a great success for our network. The second block the second cohort with 3,000. There's about 1,500 that are being trained now. We will continue to add to the list because there are some people who came through Je Contribue. So our commitment, our 10,000 commitment, we will respect it, that's for sure. Now, for the second part of your question, I want you to ask it again because I want to make sure that I understood correctly. I just want to know, where were you? Because it was promised. Well, I'm also waiting for it, this decree. I'll say it this way. It's taking longer than I thought to have a decree that I'm satisfied with. To be very clear, the mobility of personnel was really a management style. It was a culture, a management culture that we had in our network. The reasons why it's like that is because it's been there forever, the unions, the lack of staff. There are several reasons that explain this, that explain why our managers got used to working with staff going from one establishment to the other. When we said very clearly, and I'm repeating, when I submitted the action plan in August, I said, we don't have an issue with staff mobility anymore with the patient attendance. It was very clear that there would be no more mobility, but I also said that we understood the problem that we had with the nurses and the nurses' aides and certain categories of support staff. I'm giving you a long answer, but it's important. When we started our discussions with the CEOs, I said, I don't want to play the movie that we had in the first wave. People would say yes, yes, and then a couple of weeks later we saw that it wasn't implemented. When we started to write the decree, which will make the principles that we've agreed on concrete, what people are saying to us, well, how will I do my reporting? Because I have asked them, I said, if you do an exception, if you make an exception and you have to choose between well-serving the patient and having mobility, well, obviously we want to serve the patient. But now we're in the field. The CEOs have told me, well, it's difficult to do the log that you're asking us for. And I said, okay, I'll give you an extra week, but you are going to find a solution, a very clear solution to respect the commitment that you have made. And if there's some staff transfers, is going to be done with conditions while respecting the approach for infection prevention. Is it taking a bit more time than expected? Yes, but I'm going to continue to ask that the decree be bulletproof. I want it to work in the field, and the commitments that the CEOs have made, we want to be able to have them respected and to do the follow-up. For the CHSLDs, there seems to be a difference between the reality in certain CHSLDs and RPAs that have more cases than what's reported in your list on your website. Why? And what's the reality in elderly care settings? Are we worried or not? I would not worry. What I'm saying is that we have a little over 3 months ago, we have a deputy minister who only handles this, Mr. Daniel Dernay. He does the follow-up with the CHSLDs, with the nursing homes. He's the one who looks at the list, including the hospitals. It was at 114 this morning. That's what he does. What happens sometimes is that the list that we manage perhaps is not always up to date on the website. That's our challenge, because somebody will tell us, well, how come in our list, and the Premier asked me questions because we look at the CHSLDs that were in the first wave and we can see some names and it worries us. I can tell you that now we've got perhaps a delay of a few days between what I call my operational list and the list that is on the website. Mr. Dernay is conscious of this issue, but I can tell you that we are following this very closely, and people should not be worried, because what's important to us right now is the operational list. But we will try to make sure that the public list is very representative, but we're not quite there yet. To give you an order of scale, in the spring, when we were taking the CHSLDs and nursing homes and the RIs, at some point we had 8,000 people who were infected. 8,000 residents were infected. Currently, we've got around 400. So nothing like the situation in the spring. If you'll allow me, And that is why what was put in place, once again, by the team with Mrs. Rosebush, with Mr. Dernay, it's this entire system to protect against infection. It existed in our hospitals, you'll remember, but it didn't exist in our living environments. And that is what we have put in place that allows us to say, yes, there are still some infections in the CHSLDs or the RPAs, but it's not at all what we had in the first wave. Question? Mr. Dube, you talked earlier about your regional alert system, red, yellow, orange, etc. We can expect that we will have some regions in the next few months, perhaps, if we want to be prudent, who will go back to orange or yellow. Do you not fear a certain loosening of the restrictions that could bring about an increase in the number of cases? Well, I would say that I just explained the alert system, and I don't think there's a perfect system, but people are starting to see how we were targeted in our measures. I'm not going to repeat what the Premier said. We don't want to play yo-yo. We don't want to yo-yo back and forth. What people appreciate, perhaps after a few weeks, is that it takes a while to reverse a trend. Remember why we spoke about 28 days? I'll give you a date to remember. We started talking about the 28-day challenge around the 25th or 26th of September. That's just over 15 days ago. And the 26th or the 27th of September, we were at 800 cases. All right? That means that it took, if we are in a trend right now, we have managed, as of the 28th of September, we went up to 1,300 cases, and we came back down today to 815 cases 15 days later. After all of the efforts in the red zones and all the efforts of Quebecers, it takes time. So what the Premier said, you know, we don't want to play yo-yo. We'll start by making sure that we've stabilized the situation. What I would like is that the second block of October, which is beginning in a couple of days, that we can continue to decrease the cases. You'll remember that's what we said over the past few weeks. And once we will have decreased significantly, which I believe will happen because Quebecers will continue to support us in our efforts, well, by the end of October, we'll see where we are. But it takes some time. And we have to stabilize the situation. If there's one word that's important these days, it's stabilizing so that we can then decrease. Mr. Legault, I want to come back to your first remarks. You referred to this tragedy in Wendake, another tragedy linked to youth protection. We will have a report from the Laurence Commission this fall, the 30th of November, if I'm not mistaken. When can we expect changes after that report has been tabled? Well, already, a lot of things have been done by Lionel Carman. There was a significant decrease in the waiting lists in youth protection services. We added a lot of staff in youth protection, and I think that already the recommendations of the Commission, of Mrs. Laurent's recommendations, well, there's part of them that have already been applied, and they're speaking. Mrs. Laurent and Mr. Carman are speaking. This is not a secret. The faster we can act to solve problems, the better it is for everybody. But for the Wendake case, well, first of all, we will wait to see what happened. Were there some red flags? If so, when and how? You know, that's what we're going to look at. And we will be transparent. We'll tell you all of this. We will now go to the English questions.
Good afternoon. Maybe a question for Mr. Dube. We're hearing from a lot of people who aren't able to make an appointment to get a flu shot because they're all booked. The pharmacies don't know when they're going to receive more doses. So how can you guarantee that everyone who wants a flu shot will get one?
Well, we have discussed that internally. The objective was to be able to have all the material between October 15 and November 1st. That was the arrangement that we had with the pharmacy. This is quite a change because before this year, the pharmacy were supplying themselves. They were responsible for getting the material. Now it's being done through us. So there is a little bit of questioning right now, and I respect that. Some pharmacists are worried that they have not received it, or they have not received the total of what they expect. We intend to do delivery by steps, and I've asked Madame Savoie to make sure that this week, because that was the commitment, that we could start supplying the pharmacies this week. That will happen. But I think we are under control. But this is a change this year, and I think it's a bit normal that the owners are a bit worried that it will work. I think it's a change, but I think it's a good change.
So it'll happen, it just might take a bit longer?
No, it will be there, but you see, there is no point of supplying the pharmacy for the entire needs they have for the next 3 months, where we could ship it by 2 weeks at a time. This is the debate right now, but we had that discussion, I think, last Friday, and we're going to make sure that we supply them properly. That's the important thing.
And certain hospitals have lower death rates compared to other regions in the world. How do you account for their success, and what will you be doing to support workers in this second wave?
You mean in Quebec?
Yes.
Yeah. Well, I'm glad that you notice that sometimes we do, and especially this time, I think if I may, I'll go back to, and I don't know the translation for PCI. I should have learned that in the last few weeks, but the system that prevent and control the infection, okay? I think we made a lot of mileage on that, and that probably explained most of the reason why we have been able to limit the death. It was quite applied in the hospital system, but not in our CHSLD. If you look at the curve, and I'll publish another graph this afternoon showing the death curve last time and the death curve this time. This is totally different. We are in a different environment, but I'm crossing my fingers that this will last. But it's all a matter of PCI. It's all a matter of making sure that our personnel respect that. It's difficult sometimes when they lunch together and the control are not there, but I think we're doing very well, and we'll continue that.
Thank you.
We'll take the next question.
Yes, Jason Magder of the Montreal Gazette. Mr. Legault, you said today and also on Facebook, we're going to have restrictions in place for the long term, probably until there's a vaccine. You mentioned large indoor gatherings, but what do you think Quebecers should be preparing for? What restrictions do you think will be in place after this second wave is over? What should we be looking for?
But it's too soon to answer you exactly what are the measures that will be in place in 3 months and 6 months. But we know that we'll need some measures for many months, because we don't expect to have a vaccine by December for everybody. So, of course, what we're trying to do right now is to have a gradation. So we're doing that by region. So if it's not necessary to have more measures in some regions, we accept to have less measures. But I think that what is clear is that we cannot have large gatherings in small places for months.
Okay, and in the spring or in the summer, we were warned that there was going to be a second wave at the end of the summer. And it hit basically exactly when it was predicted. Is there any projections on whether or not there's going to be a third wave and when that will happen?
There is always projections and always hypotheses done, but I think it's a possibility that will depend on how fast we can have a vaccine. But I think what is important actually is to control what we are now and make the good diagnosis and the good intervention.
But it seems like the virus seems to do well when people go inside when it's colder. Are we predicting that there will be a third wave at the beginning of the winter, for example?
That will depend how we're going to be respecting the not gathering inside people, no parties, no big crowdings, because that's a factor, it's true.
Also, I would like to say, because I'm looking at the curves of the different states in the United States, especially the one in the northeast of USA. And what you see is that the curves are not the same. You have some curves that went down, but only half per million as what we have here in Quebec. But at the middle of June, they restart for a kind of second wave, but the first one wasn't finished. So do we have to really talk about first wave, second wave, third waves? You can see that it's all mixed up, and of course it depends on the measures we put in place.
Thank you. Next question.
Good afternoon, Jay Turnbull from CBC. Someone can explain to Quebecers what they should expect over the next weeks, months. Are we going to, you're mentioning in French, Mr. Legault, they're opening the taps. Okay, so the 28th of October, Montreal will no longer be in a red zone. So you're saying we're going to loosen some restrictions, and then what do we wait for? The numbers might go back up again. We'll go back into a red zone. What can Quebecers expect?
We know that we'll still have to wear masks. We'll still have to be at 2 meters of the other people. And what I said today, it looks like large gatherings inside. We may need not to have that for some time.
I mean, if you're a restaurant owner, for example.
What size of restaurants?
Okay, how about you can fit 150 people in your restaurant? Are you going to have to shut down? Are the restaurants going to have to worry again if, when you open up the taps, as you said, on October 28th or whatever the date might be pushed to, should restaurant owners then be worried that for the next red zone?
It depends on many things. It depends on which regions you're in. Second, the size of your restaurant. So it's not easy. It's something that we discuss every day with the public health. You want to try and answer?
Well, the one thing that I would like to think, and we'll show you data in the next few days on that, is that really how important, irrespective of the sector, whatever it's a restaurant, whatever it's sports or whatever, is the number of contacts that you have per day per person. And we have commanded a special study for us first to understand what would make, remember I talked about that a little bit last week, where we were before COVID, say at 8 to 10 contacts per person per day, how we went down because of the confinement down to roughly 3 contacts per day. We were able to go up to 6 or 7 with a combination of confining and the measures that we've talked about. And I think when you'll see this study, because we have asked additional questions to the people conducting this study, and I think you'll see that it's not only the matter of the sector, but the number of contacts that we can eliminate. And I think when we see that and we discuss that, first, I think that will convince people that the job we do right now, when I say we the Quebecers, we're doing a very good job because we're focusing on the reduction of those contacts. And after that, then I think it will be easier to continue to what we're doing. But we will publish those studies in the coming days, and that's a very important one.
But if you're a child who wants to play hockey, ringette, you're a restaurant owner, you own a movie theater, could they expect, the 28-day challenge ends October 28th, or whatever the date is. Can you tell us now that won't happen again? They won't be going back into a red?
We cannot say that. But what I would like to say is exactly what the Prime Minister just said. Let's hope and to be at the lowest level possible at the end of October. Remember what I said. Stabilize, I think we're doing that. The next step, let's put it as low as possible, because the lower we have, the room of maneuver that we have. If we're too high, we have no room. If we take it very low, then we have some room. I think let's focus on where we're going to be on October 31st. 28th, sorry.
Also, the numbers.
One quick last question.
Okay, the numbers of numbers are slightly down, but the numbers of testing over the weekend has dropped pretty dramatically. Of course, it's a long weekend. How much does that play into, I guess, Dr. Arruda, the question's for you. How much does the number of people being tested play into the number of cases going down? And would you attribute it more to that or more to the measures?
It depends where the numbers are going down, in a high prevalence region or in a low one, you know. In the low one, even if you test less, you will find no much cases with this. It's a factor, it's clear. We have observed by the end of the weekends that sometimes we get a little down and it corrects by themselves. But we are seeing also a tendency to go down independently of the weekend and the level. So, and we redistribute those cases in the graph. So I think that's not as it was before, because we have some variation, it's true, but we are not testing only 10,000 or 6,000. We are testing over that, actually.
We'll go with Gloria Enriquez from Global News.
Good afternoon. I wanted to ask you about the new cohort of orderlies that recently graduated, and they're quitting what they say over broken promises. They say they're not getting the conditions or the pay that they were promised. What do you have to say about this?
But maybe I'll start. First, I will repeat that at least for the 25th time. They will receive the pay they are supposed to receive, which is $49,000 a year. Second, I think that over the 7,000 people who started to work a few weeks ago, I think that there's something like 30 who decided to leave. And it's normal because it's a tough job.
But some of them are saying that they're not quitting just yet, but they are thinking of quitting because they were promised $26
That's
an hour.
not
They're
true.
only getting 20.
That's not true. Of course, you have to take into consideration that we are in negotiation with unions. Second, it's clear. Now they get the $26 with the premium. As soon as the new collective agreement will be signed, they will receive the $26 in the basic salary. But they will get the $49,000. It's clear. And how can I repeat that and be clear? For me, it's very, very, very clear.
One last one, if you have one.
Yes, for Mr. Dube. I just wanted you to repeat your comments about how you thought this weekend went and what we saw on Mont-Royal this weekend.
Yeah, but I said I think we want to pay a lot of respect to Quebecers, the way they have behaved with regards to the sanitary measures. And I was giving the example of how many people were on Mont-Royal this weekend, and the way I would say 99% of them were in big groups, but in separated groups. There was a lot of people, but I think we saw, and I saw a different image than we would have seen, for example, I repeat that, at the Tam Tam a few weeks ago. And I think I want to say to the Quebecers, they've done a great job. I know it's disappointing because they don't have that many places to go, and some were refused to go, but I think we need to prevent them to be in large groups. But so that's the first thing. The second thing is we still have people that don't follow the rule. We saw that in Bois-Brillant this weekend, and I want to pay tribute to the policemen because they have done a very good job in displacing more than 750 people that were gathering for a religious event that they should not have done. And I think I'm really thankful to the policemen that they've done a good job because that could have been worse. I don't know how many infections we'll get out of that, but I think that could have been a lot worse. So.
Do you have an idea of any infractions, tickets that were given?
Oh, yes. There were some infractions and some penalties or contraventions were put to some people, and some people were arrested as well. So I think that's important that the policemen did their job.
Thank you.
We have one last request from CTV.
Mr. Legault, you spoke about it in French, but can you just say in English your statements on Wendake and what
When
happened?
what?
On Wendake?
Wendake,
Yeah.
yeah. But I want to offer the family and all the community in Wendake all my condolences. Of course, we're always shocked when you see 2 kids being killed. How can we see that in 2020? We'll have some inquiries that will be made by the police, by the Commission of Youth, but also Lionel Carman asked for all the details about the notification that had maybe be given to the DPJ, the Direction of the Protection of Youth, in the last months. So when we'll have the information, we'll give you all this information. But of course, it's terrible.
Merci beaucoup tout le monde.
Merci tout le monde.
Merci.